This is pretty funny, too. Chris Hayes had Congressman Leonard Lance, who was on the House Energy and Commerce Committee. And we've made this point. The Republicans already have a bill that they passed in 2015, the House and the Senate, because they knew it was going to be vetoed by Barack Obama to repeal and replace the Affordable Care Act. They can't agree on that. They've come up with a bill and they need to rush it through because they're afraid of opposition from all quarters, essentially, defeating this bill. And here is, and you'll recall, right? They rammed Affordable Care Act down our throats.
They
jammed
it. They jammed it.
Hammed
They inserted it. They forced it.
All down our throats.
Down our throats, regardless of gag reflex.
Nobody read the bill.
Because it's too big. You can't.
Here is Hayes with Leonard Lance from the House Energy and Commerce Committee. The Democrats tried to slow the process down in committee. They extended it for 27 hours. They had a 27-hour marathon session. But here is Hayes asking a simple question of Leonard Lance, and he really doesn't want to answer it.
How many hearings, open hearings with witness testimony and the like, have you had on this bill?
We've had a series of hearings over the last several years on the Affordable Care Act.
No, in this Congress, though. How many hearings in this Congress on this bill?
We have gone to the American people with Paul Ryan's Better Way, and we campaigned on the fact that we were going to improve the system.
No,
and
I totally
think that's
get that,
what we've done.
Right, no, I get that, but there's legislative language now. I'm just curious, how many hearings has your committee had on this bill?
We had a 27-hour marathon session, and I think all of the issues were vetted, and I was very proud of the committee in our bipartisan capacity.
The one that went through the night. But how many hearings with witnesses called to offer their expert testimony, whether that's doctors, people from the insurance industry, other folks, how many hearings has your committee had on this bill?
We've had a series of hearings over the last several years on the issue, and we campaigned, Chris, on this matter over the course of the election cycle.
In this Congress, I'm sorry, I don't want to belabor this, but in this Congress, is my understanding, in this Congress on this legislation, there have been 0 hearings, but for the 27-hour marathon markup that went through the night. Is that correct?
And also the marathon in the Ways and Means Committee, and also the fact that we have explained our position, and it was completely transparent over the course of the 27 hours, and I thought it was an excellent discussion on both the Republican and the Democratic side.
Congressman, you're talking about a fifth of the American economy. You're talking about maybe 15 million people losing health insurance, and you're saying that 27 hours going through the night is sufficient.
I think that we have to move forward. I suspect that when it gets to the Senate, there will be a discussion there, but I do think the American people, Chris, want us to reform Obamacare, and I am committed to doing that.
I suspect there'll be discussion on the Senate floor.
I also really liked the 2-for-1.
What's
like, it's like, oh, you're not counting also the Energy Committee.
Right.
So when you combine those, that's like a lot of time, man.
And that's also a reminder. The CBO is expected, because the Republicans are trying to rush this so quickly, the CBO doesn't have a chance to score it, as they call it. But it's anticipated that 15 million people will lose their health insurance over the next 10 years. We'll have 15 million less insured because of this bill. So, but who knows what the bill's going to be? There ain't going to be any hearings. Boop-boo, doop-a-doo, oop-a-doo.
Well, it's a short bill, so you don't need hearings.
Hey, folks, Sam Seder here. Donald Trump can kiss all of our asses. And one way he can is by you subscribing to this channel. I don't know how that works.